Hello and welcome to continuing coverage of the World Healthcare Congress 2012. I'm very pleased to welcome Barbara Parfitt to the studio chair today. And it's nice to get an update from you, Barbara, because you had started a nursing school in Bangladesh back in 2010.
Right.
And here we are 2 years later. It's called the Grameen Caledonia Nursing College. What sort of challenges have you faced in these last 2 years?
Well, perhaps, think about challenges, but think about opportunities as well. Let's think about those, because things overall are going really well. We have 128 students now. They are thriving. They are becoming assertive, creative, enlivened, liberated. All of these things I would describe them. They're learning, they're studying, they're entering into their work with tremendous enthusiasm. And we're really excited about meeting our aims of developing leaders, decision makers, and future nurse practitioners. These are the really positive things that I can share with you that are actually happening. Mm-hmm. The other really positive thing that's happening is that we're preparing our faculty. I mean, this is the challenge as well as the opportunity. Nurse teachers in Bangladesh are very few. There's no opportunity for nurses to follow higher education, or very little. So we have very few nurse teachers who are able to provide the level and quality of teaching that we require. So we are taking faculty who have the potential, who are risk takers, who want to learn.
Yes.
They're clinical nurses who have a lot of expertise, but they have their teaching experience is the wrong kind of experience. It's because the traditional way of learning in Bangladesh for nurses has been rote learning. Mm-hmm. And that doesn't
just throw them on the job.
It doesn't. No. It's well, they do that too, but basically you hand them a textbook. You say learn the chapter, and we'll examine you to see how much you can remember. That is not the way to learn. They do learn on the job, but of course learning on the job is not good, because here's another challenge, because the quality of care in Bangladesh is very variable. You might have some hospitals with fairly good standards of care, but the other hospitals are poor. So in summary, I think our challenges are around the quality of care and the experience the students can get, how we can make sure that they learn good quality care when they have to practice in very poor quality clinical environments. We are also challenged by the status of the nurse in Bangladesh. Nurses do not have a very high status. They're not considered to be very intelligent or very helpful, and they're not fully incorporated into the healthcare system. Mm-hmm. And we're trying to raise their status. We're trying to give them the confidence to be able to say, look, we can contribute to this healthcare service.
Do you have the resources and the equipment to provide good quality health care?
We're getting it. Mm-hmm. Well, we're not providing the health care, we're providing the teaching.
Yes.
Bangladesh itself, in places, does have that. A lot of the poor care is not to do with resources. It's to do with poor management, poor leadership, and lack of motivation. Because many nurses in Bangladesh have very little to motivate them. They're not given very good career opportunities. They don't get in-service education and training. They're not supported as part of the team. So in a sense, there's no expectation that they would perform at a high level. So they have no guidance, they have no leadership. It's not their fault.
Yes.
And they do the best they can. Mm-hmm. Now, there may be in some circumstances poor resources, but on the whole, you don't need resources to be kind and helpful to people. You don't need resources to explain medication to patients. You don't need resources to make people comfortable.
You've come quite a long way, though, I sense, in the last 2 years. Where do you think you will be 2 years from now?
Well, where we've come to at the moment is that we have we've set up an institution. So we have the infrastructure to provide educational for nurses. That's really important, that you have your HR department, your finance department, your actual institutional infrastructure.
Yes.
That was a big part of the early stage, setting all that up. And we're now running the basic diploma program for nurses.
Yeah.
We hope by next year to include the BSc, that's the degree level studies for nurses. We are planning in September to start a teacher training program. so that we can train nurse teachers, because as I said, we're very scarce on good teachers. We hope that we will then introduce the master's program in 2 or 3 years' time. And then my big dream is that we're hoping to set up 2 training clinics, 2 model clinics where we can actually train our nurses in community health on the job at a high standard. Wow. And so we're looking at the moment about how we're going to do that. We need to set up the clinics, and in those clinics we want to demonstrate integrated healthcare delivery, how the doctor, the nurse and the community health worker and the paramedic can all work together.
As a team,
and the patient's journey and the decision-making tree can be clearly identified for each of these cadres of health workers. And that's what we're trying to do next year and the year after. And then our big thing, of course, is we hope to be moving into our new premises. We're having purpose-built premises. At the moment we have rented accommodation because we're expanding at such a rate we're now bursting at the seams. We have no more room. So by 2014 we expect to move into our purpose-built nursing college.
Fantastic. Wow. Challenging, but so exciting. And
really exciting.
We really look forward to getting an update next year. Thank you, Barbara.
Thank you very much indeed. Thanks for your time.
I'm Mabel Jong. Thank you so much for watching.